Hey there! Today we will be talking about pulmonary embolism or PE. You may have heard of pulmonary embolism before or know someone who has suffered from it. If you have, then you know that PE can be a fatal condition that requires proper medical attention. So what exactly is pulmonary embolism? It is caused by a blockage in the pulmonary artery, which is responsible for carrying blood from the heart to the lungs. This blockage is often caused by a blood clot, usually starting in the lower legs. This blockage can block the flow of blood to the lungs, which can be extremely dangerous. It's important to understand the risk factors as well as the signs and symptoms of pulmonary embolism, so that you or your loved ones seek for proper medical attention. Across studies, the biggest risk factor for having PE is age. For every 10 years after the age of 60, the risk for having PE doubles. However, age is not the only risk factor. The other risk factor includes obesity, high blood pressure, smoking, history of blood clotting, surgery, and inactivity or some other factors. Being immobilized after any kind of surgery also leads to an increased chance of having PE. In addition, prolonged sitting such as sitting in a long car rides and plane trips can also lead to PE. But how do you know if you're having PE? Common signs and symptoms of PE include shortness of breath, sudden chest pain or cough that may or may not produce blood air from a mucus. Other signs and symptoms include leg pain or swelling, discolored skin, fever, excessive sweating, rapid or irregular heart rate, or dizziness. Symptoms of PE are similar to other conditions, so if you experience any of these symptoms, make sure to seek immediate medical attention. It is also important to know that some people who have PE do not have signs and symptoms, which can make it very difficult to diagnose. So how do you determine whether you have pulmonary embolism? PE is mostly common diagnosed when you're in an emergency room. It requires medical history, physical exams, and some diagnostic tests. Using your medical history, the physician will know the present risk factors for PE and rules out other possible causes with symptoms you're experiencing. The physical examination involves checking the legs for any signs of clotting, checking blood pressure, and heart and lung function. If the physician still believes that the PE was the cause of the symptoms, they can conduct various diagnostic tests to confirm this. This includes CT scan, ultrasound, and blood tests. The main goal of treatment for PE is to stop the blood from getting bigger and to prevent new blood clots from forming. There are various forms of treatment for PE which include medications, procedures, or other therapies. Medications for PE. This includes anticoagulants, which are blood thinners, and thrombolytics, which are clot dissolvers. Blood thinners are the drug decreases your blood ability to clot. They prevent clots from getting bigger and prevents new clots from forming. But they cannot break up already formed clots. Specific types of blood thinners include heparin, which can be either given as an injection or through a needle inserted into a vein, or warfarin, which can be taken orally as a pill. Clot dissolvers are medications that are given through the vein and have the ability to dissolve clot quickly. However, clot dissolvers can cause sudden and severe bleeding and reserved for life-threatening situation in an emergency room or hospital. In a case of very large and life-threatening clot in the lungs, the doctor may suggest removing the clot using minimally invasive procedure. Besides treating PE, there are many other things that can be done to prevent it from occurring. For example, since prolonged bed rest after any times of surgery puts you at higher risk for PE, it is important to start moving around as soon as possible. It is also important that you take any prescribed medications to prevent clots from forming, as well as exercising your lower leg muscles, especially after a long period of sitting, is helpful in preventing PE. Compression socks can also be worn to reduce swelling that a blood clot in the leg may cause. The sock is worn from foot to the knee and causes gentle compression or pressure of the leg that prevents blood from clotting. For individuals that had PE before and risk for blood clots but cannot take medication or respond to them, inferior vena cava filter can also be used to prevent another PE from occurring. Vena cava filter is a device that can be inserted to blood clots from traveling to the lungs. The filters inserted inside a large vein called inferior vena cava catches clots before they reach the lungs. These filters are a safe and effective method of preventing PE. To sum it up, pulmonary embolism is a severe condition that needs to be properly diagnosed and treated. If you think your friend or family member have symptoms of PE, it is important that you seek medical attention immediately.